Okay, well, we might kick things off. So good morning and welcome to another Starts at 60 Masterclass. I'm Adam Jones. I'm your host today and the CEO of Starts at 60, the online home of the Aussie baby boomer. We're dedicated to bringing over 60s the latest in health, money, property, lifestyle, and entertainment news and resources, as well as great deals for our members. So if you haven't already checked out the website, please head on over to startsatsixty.com. Importantly, why we're here today is it's World Hearing Day, and we've proudly partnered with Cochlear, the global leader in implantable hearing solutions. And with the help of this wonderful board of panelists, we're going to discuss the importance of being proactive about your hearing and what the hidden risks associated with untreated hearing loss are. So whilst we all know someone with selective hearing, and I'm sure my wife would tell you I'm one of them, would you know how to identify the signs of hearing loss if it was taking place with yourself? And if it wasn't as good as it used to be. So, we're going to really unpack, could healthy hearing be the key to healthy aging, and all will be uncovered in this session. We're going to take about 50 minutes while we learn from our panelists and interview them, and then 10 minutes where we gather up, groups of the best questions that we've had for the day and get our experts to cover them for you. So let's meet our panelists. First up is one of the most experienced cochlear implant surgeons in the world. Introducing Clinical Professor Berman. Kathy has performed more than 1,800 implant procedures for children and adults from as early as 3 months old right through to 95 years old. She's a pioneer in the field of cochlear implants, particularly for adult outcomes. She is the medical director of NextSense, which is the leading cochlear implant program in Australia. Thanks for joining us, Kathy.
Thanks for having me here.
Great. Next, I'd like to introduce Lisa Coetzee. Lisa has a passion for client outcomes and patient-centered care. She's applied this to her work as an audiologist at the Lions Hearing Clinic and her management decisions as the operations coordinator and head of Lions Clinic. She draws on her extensive experience leading the clinical department at Ear Science Institute Australia, offering a complete hearing service from hearing aids to cochlear implants, successfully ensuring that the client journey delivers positive outcomes. Welcome, Lisa.
Thank you for having me.
Finally, we have Joanna Hegazi joining us. Jo spent over 10 years in the medical device industry and has a passion for helping others hear better. She leads Cochlear's candidate engagement team here in Australia and New Zealand, who provide free information services for those considering cochlear hearing solutions. Thanks for joining us, Jo.
Hi, everyone.
All right, now let's get right into it. So we know staying socially active, keeping our brain sharp, and maintaining physical mobility and health are some of the key factors to healthy aging. But what a lot of people don't seem to know is that there is an important link between healthy aging and the ability to hear well. So we'll start with you, Kathy. Why is it important for us to take our hearing health seriously? And what does hearing health have to do with healthy aging?
Okay, well, great questions and very topical on today, Hearing Australia Day. So I'll just share my screen. I've got a few slides to help us along the way. So what we know is that 1 in 6 Australians have hearing loss. So it's really common in our society. But by the time we're 65, 1 in 3 of us will have hearing loss. So it's increasing with age. And by 70, in fact, 2/3 to 3/4 of people will have hearing loss. I'm now not sharing properly, sorry. Can you see?
Yep, it looks fine from our end. I think you can crack on.
Okay. Hearing loss can be associated with withdrawal and loneliness. It can be associated with depression and anxiety, and is in fact an independent risk factor for dementia. I'm sorry, my screen just won't go forward. I'll stop sharing for a sec, maybe that's easier. And hearing loss is much more than just our hearing. It can affect our whole health. So it's a risk factor with falls and frailty, It's associated with hypertension, with cardiovascular disease, with diabetes. So any of these other medical conditions is actually a good idea to have a hearing test, because you may well actually have some hearing loss there. And the impact of hearing loss is huge. So we find that people will often retire earlier because they're struggling in background noise. And as I mentioned, it's associated with more withdrawal from fun things like catching up with friends at a cafe or family. And the whole cognitive impairment, which we'll talk about a bit later, has been a big issue on people's radar, that hearing loss is an independent risk factor for cognitive impairment and dementia.
And what are the common causes of hearing loss? Is there a link between hearing loss and age?
Look, there certainly is. I'm going to try and share again. I'm so sorry. We did check if everything was working and it just stopped, didn't it? Okay, so so there's different types of hearing loss. So we have conductive hearing loss, which is either a blockage or something not working well in the outer ear canal or the middle ear. And we have sensorineural hearing loss, which is the inner ear and the nerves through to the brain. And so from a sensorineural point of view, there's lots of causes for sensorineural hearing loss. We think of congenital hearing loss, with little kids having born with hearing loss. But in fact, probably a third of our adults and our seniors have some component of congenital hearing loss in there as a cause of their hearing loss. Age is an independent risk factor and cause of hearing loss, just the wear and tear of our ears. Slowly, little hair cells die over time. Noise exposure is a big risk, and often the generation above us had terrible hearing loss because of noise exposure. Medications, head injuries, infections can all be a cause of hearing loss, and of course other medical conditions as well. What we know is that normal hearing is at about 20 decibels, and normal conversation is at 60 decibels. But what happens as we get older is we lose that high frequency hearing loss. And so it often means it's harder to hear children's voices or higher pitched women's voices, or some of the speech sounds like an S sound, a TH sound, an F sound. They're more high frequency sounds. And so we just notice it's harder and harder to hear as that high frequency loss goes.
Interesting. And I noticed when you say that sometimes it's harder to hear higher pitched women's voices, that may be the reason for selective hearings from some of the husbands out there.
Well,
or is that a bridge too far?
I wouldn't say that, would I?
No, we all really do seem to take our hearing for granted until we suddenly find ourselves straining to hear conversations or missing some of our favourite sounds. But it can be difficult, I think, because of the gradual nature to realise the change in the quality of our hearing at first. But Liz, what are some of the early warning signs that you would look out for?
Thank you, Adam. I'll also share my screen. So let's see if this works. Okay. Okay, so can you see my screen, Adam?
We can, yep. So far, so good.
Perfect. So I'll sort of go back to Kathy's point, and 1 in 6 Australians are living with hearing loss. So it's so important that we understand what those symptoms are. But even more importantly, people are waiting 7 years to take action on the hearing loss. And it's actually between sort of 7 and 10 even, some of the research is saying. So people are really delaying it, and it's because of exactly what you're saying, Adam, that gradual nature. So it's important for us to understand what those signs may be. So, you can maybe recognise these signs in yourself, or you may recognise them in a family or within your family or with a friend, but they may often ask you to repeat yourself. They often complain that people are mumbling, that maybe the grandkids are not speaking as clearly. That could often be a sign of losing those high frequency sounds, like Kathy said before. Feeling really tired at the end of a day. You've done a normal day's work and you used to be fine at the end of the day. Now you come home and everything is drained from you. That can often be a sign because you're straining so much to hear. reduce social activity or withdraw. I just don't feel like going to the bowls club anymore because I don't feel that connection with my friends, or I can't hear in that situation. So it's easier just not to go. Dominating the conversation, because if we talk, we don't have to listen. So that's often something that you probably won't recognize it in yourself, but you'll recognize it in a loved one. So that's a very common one. Confusion or miscommunication. So we're going out for dinner at 6 or at 7. You know, I was ready at 6, or, you know, but dinner is only at 7. So having those little confusions there. Unexplained sadness or depression. So you may think, I just don't want to go to the bowls club anymore. But then now I feel really upset because I'm not connecting with the people that I love. Needing the TV volume higher. As an audiologist, you always have people saying, you know, I used to have the TV at, you know, 13 and now it's gone up to 20, you know, that's really a sign that there is some hearing loss creeping in. It's also really important to understand tinnitus and vertigo, so ringing in the ears or balance disturbance can also be associated with hearing loss. But given the prevalence of hearing loss, we really should all have good practices and be proactive. So it's about identifying the signs. But if you are over 55, have a hearing test. It's so important to have a regular hearing test. If you do have dizziness, if you have ringing in your ears, have a hearing test. If you've got exposure, if you've had exposure to noise, very, very likely that you do have hearing loss. And then, of course, if you're exhibiting any of those signs, I really would recommend that you have a hearing test. So I'll pass over to you, Adam.
Yeah, thanks. I think going through that list of warning signs that you shared with us, there's some that are probably more obvious and others that maybe aren't as obvious, but certainly as we went through it, you know, a lot of them resonated with me. And I think for a lot of people in the Starts at 60 community, they can probably identify a lot of those within loved ones of their own who they probably know are holding off getting the help that they need. So maybe over to you, Joe, if you could give us an overview of some of the hidden risks that are associated with ignoring hearing loss, whether it's lack of prioritization or just simply being unaware.
Yeah, look, when talking to people with hearing loss, and Kathy and Lisa have gone through this and touched on it, they're often mishearing parts of the conversation or constantly asking people to repeat themselves. And ultimately, they've started to withdraw from the social interactions that they really enjoyed. And the hidden risks and impacts to this withdrawal are, you know, a loss of self-confidence, you know, a loss of feeling or having a sense of independence. They may be reliant on their loved ones to join them, to be their ears. I've heard a lot of wives say, I'm my husband's ears, or, you know, my wife's ears. You know, and not being able to fully be active in the environments, that, you know, the family dinners and, you know, the social events and functions, you know, that they once enjoyed. So there's an isolation that comes with that, and everybody would have had experienced this to some degree during COVID. You know, when we couldn't socialize with our friends and family, it's really that sense of isolation that comes with the hearing loss. So hearing loss can really take a social and emotional toll on people. But you're right, it doesn't only impact the individual, it really impacts the loved ones around them. So, you know, around 30% of the people our team talk to are actually the loved ones of those with hearing loss, excluding selective hearing as a inquiry, of course. You know, but it's the spouses, it's the adult children, and from their perspective, you know, they talk to us about how the hearing loss is impacting their relationship, the ability to communicate with one another, you know, do the things together that they once enjoyed, connect with the grandkids. So it's those children's voices, as Kathy mentioned, with the high frequency loss. You know, it's stopping their ability to really connect with the people that they love the most and the sounds that they love to hear. The loved ones may need to start taking a little bit more of an active role, you know, in the management and the organisation of the household, and you know, as I said, be the ears, you know, for their loved ones. So often when we talk to people with hearing loss, they soon realize that they've lost more than just their hearing loss. You know, they've lost the social engagement component that we really know is pivotal in healthy aging. You know, and then on the other side, you know, we're often told by people who treat that hearing loss that they really had wished they had done something sooner, you know, instead of waiting, to Lisa's point, around the 7 to 10 years of treating it, that because it's that reconnection, or being able to reconnect, they realize, you know, they may, or they shouldn't have waited as long as they did.
Yeah, I mean, the message that I'm getting from the information you've all shared so far is that personal impact on the individual is just as great as sort of the physiological impact. So, Lisa, can you expand at all on what the mental health impact of hearing loss is?
Yeah, and Adam, I'm going to share my screen again.
Sure.
To bring that across. And I think Kathy's slides weren't working, but I think Kathy had a similar slide like this on her deck. And it really sort of highlights that all those conditions that are associated or caused by hearing loss and mental health and social isolation are key points that our having hearing loss impacts. The Bustleton Health study was really one of the studies that really showcased that connection between hearing loss and other conditions. But what I'll bring up here is, so Joe mentioned it before, social connection plays such a vital role in our health and our well-being across our lifespan. People who have meaningful social connections live longer and have much better health outcomes. But what we are seeing, loneliness and social isolation are twice as likely, and depression 4 times as likely in those 1 in 6 people that have hearing loss compared to a normal hearing population. So that really is profound statistics. So we know hearing loss is very prevalent. Now, that connection between hearing loss and mental health is you know, even more prevalent. So really it's something that it's so important for us to consider. But what I really wanted to, because I think, you know, sometimes we talk about the negative side and, you know, the impacts, but what the research has shown is if we keep socially active, we can age healthily. Healthily, I think is the word. The good news is addressing our hearing loss through wearing hearing devices has shown to have a protective effect against a protective effect and allow for greater social participation. If you can hear, you've got confidence. If you can hear, you can have that connection with people and enjoy, and that is so important. So that was actually a research by Dr. Weinstein. So it's not just, I guess, hearing aid companies saying that, but actually research saying that if you address your hearing loss, it can have a positive impact on your mental health. And I'll pass back to you.
Thank you. Yeah, I mean, something that I think in recent years has become more and more clear is how interconnected all these various parts of our health are, and that, for example, hearing loss isn't an inconvenience, it's actually a far greater issue, and it has these effects on mental health. And I think that actually segues really well into something I'd like to speak with you about, Kathy, is I saw there are a number of studies now that discuss a link between hearing loss and cognitive decline, as well as an increased likelihood of developing dementia, which when I first heard was fascinating and scary, and I think made it clear that hearing is a far bigger issue than potentially some people realize. So are you able to tell us more about this?
Yeah, certainly. And I'm going to try again with sharing my slides just to make it clear, but let's see if it works this time. All right, are we up and running?
Yes.
Yes.
Looks good.
Okay, so you're quite right, and there was a lot of information coming through, and then I think the Lancet produced two big studies, both in 2017 and 2020, really looking at factors that are risk factors for dementia, and they identified that hearing loss, if you look at a whole journey of somebody through their whole lifespan, but hearing loss in middle age was responsible for 8 to 9% of actual dementia in old age. So that's really identified that we actually need to be doing something much more proactive from middle age onwards about our hearing. Frank Lynn, professor at Johns Hopkins University, has done a lot of work in looking at that hearing loss and cognitive impairment and dementia. And this was a study, they did a longitudinal study following up people of 65 years and above. And what they found was that over a period of 10 years, if you had a mild hearing loss, you had twofold risk of developing dementia over that 10-year period. If you had moderate hearing loss, a threefold risk. And if you had severe or profound hearing loss, actually a fivefold risk of developing dementia over a 10-year period in this cohort of patients that they just followed up. So the degree of hearing loss is really important as well. And I think that is all part of what Lisa was saying with and Joe was saying about, isolation and engagement, etc. And people wonder, well, how does this work? And I guess there are theories. We don't know for sure. There's a lot of work looking at that. So, one theory is that in fact, it's not causing it. There's just common causes for both hearing loss and for cognitive impairment, such as, smoking or hypertension or cardiovascular disease. So, but, something else is causing both of these, and we just see an association. But what we do know is that hearing loss does lead to that reduced socialisation. And we know that reduced socialisation is a risk factor and a cause of some cognitive impairment for some people. So we can see that direct link. We also know that with hearing loss over time, especially age-related hearing loss, we actually have shrinkage of the brain in the area that uses auditory sound, like listens to sound, but we also get shrinkage of the whole brain overall in people who have hearing loss. So maybe that is then causing the cognitive impairment. And then another possible thing is that, it's just cognitive load. The brain is just too busy trying to actually listen and work out what people are doing to the detriment of other functions that the brain needs to do. So it's a bit like too busy to actually then put out the garbage or do other things that the brain actually needs to be doing. So there's certainly lots of theories, and probably like all things in medicine, there's a bit of everything playing out, but over time we'll see a bit more. Frank Lynn at Johns Hopkins University has done a huge study with 997 people called the Achieve study, looking at whether stepping in with hearing aids and cochlear implants will actually then slow down the risk of dementia or cognitive impairment. So we really look forward to that study. But what we know is that if hearing loss is the most common risk factor, any risk factor that you can affect, and that's in middle age, then we really need to be screening for hearing loss from middle age. So, we often say 55 or 50, we actually need to be screening for hearing loss. We can't wait for people to miss out and have that time where they're not having some support for their hearing, either through hearing aids or cochlear implants.
Thanks, Kathy. That's really, really amazing research. And so I suppose it leads to the obvious next question, and I'll ask this of you, Lisa. Once someone's identified that they have a hearing problem, what are the next steps and what are the options available to them?
Thank you, Adam. Let's go over here. So the first step really is to get a hearing test. And I've said it, Kathy has said it, it is to just get the hearing test, whether that's a screening to start with if you're not too sure, but really getting a diagnostic audiological test with a qualified audiologist. It's usually about an hour for the assessment. That's the most important thing. There's usually no referral required for a hearing test or to see an audiologist. Just as of this week, the 1st of March, there's now Medicare rebates available with a GP referral. So the whole appointment may not be covered, but part of that appointment will be covered. And then Hearing Services Program is eligible and provides funding for hearing services, so both the assessment and devices for people on a pension and for DVA card holders. So that's important to get a hearing test and understanding the funding. And then the second step is understanding what the options are. So there are many interventions that are available. There are certain types of hearing loss, like Kathy mentioned, like a conductive hearing loss that could be treated by a GP. Sometimes you do need to see an ear, nose and throat specialist to medically treat that hearing loss, or there may be surgical treatments that can actually correct the hearing loss. And then if that's not suitable or not required, some people have more milder hearing loss. So just something like communication strategies, which I'll go through in a second, may be beneficial, or there are devices. So certain hearing losses would just benefit really well from getting a device, and we can go through those. So communication strategies is just strategies that we teach both people with hearing loss and people, their loved ones, their communication partner, on how to better communicate, to speak clearly. As an audiologist, I have many clients coming to me and go, well, I can hear you perfectly fine because I speak clearly, I pronounce my voice, I don't shout, I don't speak slowly or anything necessary, but I just speak clearly. Limit the background noise. So that's why at the Bowls Club, it's hard because there's lots of background noise. Maybe you can go and sit out on the balcony when you're at the Bowls Club because there's maybe not noise out there. So that really, really does help because the speech is then louder where if there's lots of noise, often the noise covers the speech. Rephrasing, don't just keep saying the same thing. What do you want for lunch? What do you want for lunch? What do you want for lunch? Do you want a sandwich for lunch? It is just rephrasing what you're trying to say because there might be something in that sentence that the person can't hear. That the high frequency sounds because they're missing them if you say it differently. Using gestures, pointing, being more expressive in your language and just merely being closer to the person. Reducing that distance makes the speech louder. So those are very basic things and probably everybody should incorporate those in communicating with everybody. We've got devices, we call them assistive listening devices. These devices you can use with or without hearing aids. And in some cases, they're for people that just need to hear in a specific situation. So the TV headphones, if you just need to hear the TV better, but you're coping really well in other situations, you may just need a TV headset. Or a phone that actually rings louder and the handset actually is louder as well. You may need an alarm clock for next to your bed when you take your hearing aids or your cochlear implants off at night, an alarm clock that's louder or that vibrates to wake you up. So there's lots of those kind of devices that would support you with milder hearing losses or to use with your actual hearing aid. And then we get to our hearing aids. So hearing aids have changed a lot over the years. Hearing aids are a very common intervention. Essentially what it does is it takes the speech in, it processes that sound and makes it louder for the listener. So that's basically what it does. There are many different types of hearing aids and I've sort of, arranged them here. You've got really small little devices, a lyric that's put into your ear canal. You can't see it at all. It gets put in with a microscope and it sort of stays there for approximately 6 or 8 weeks, then the audiologist takes it out and puts a new one in. You've got devices there in the canal or in the ear, and then you've got the behind the ear style hearing aids with either a receiver in the ear or a mold. Really the way the audiologist chooses the device that's best for you is based on your listening needs and your type of hearing loss. But we also look at things like, what is your dexterity? What is your vision like? Because some of the hearing aids are easier to manage than other hearing aids. So what we also do as an audiologist, hearing aids are specifically programmed for your hearing loss, like a prescription in your glasses. So an audiologist actually takes your hearing test and then programs that for your hearing loss. Hearing technology have progressed so far over the years. You know, I think there's many people that still think hearing aids are bulky things that sit behind your ear and they whistle and they end up in the drawer. Hearing aids have come a long way. Hearing aids now pair with your computer. I actually have a set of hearing aids that when I have calls like this, I just use my hearing aids to stream to the computer when I'm sharing an office with somebody else. So, you know, you can do things like everybody else does. You stream from your mobile phone. You can have a phone call on your phone. They're rechargeable. So there's no longer the little fiddly batteries that are, you know, it's hard to put in and you lose them. And are they dangerous if you've got grandkids around or your kids around? So it's really improved a lot. And maybe my question is going a bit further than what you asked, Adam, but the outcomes are very, very good with hearing aids. The better the outcomes are is getting tested earlier and getting a hearing aid early. And the reason we say that is because it keeps your brain and your ears stimulated. If your ears and your brain are not given any sound, it sort of just goes a bit lazy and it can't interpret the sound anymore. So the earlier you get it, the better outcomes, but also your dexterity is better at that time. Your vision is better at that time. So just that adjustment to something new is so good. And as an audiologist, what I always say to people, if you've got a hearing aid and it's sitting in the drawer at home or you're thinking this thing just doesn't work for me, go and see your audiologist. It might just need a clean. It might just need a little bit of adjustment. Maybe the hearing aid is not suitable for you, or maybe you do need a cochlear implant. And I'm not going to go into that, but a hearing implants are very, very important solution, which an audiologist will discuss with you. And Kathy will talk to us more about actually what hearing implants there are.
Thanks, Lisa. I'm glad you touched on the hearing aids because I think there's a lot of misconception about them. And certainly from myself, my mental model of them is sort of the late 80s, early 90s. And, you know, my grandfather having one and always seeming kind of angry and turning it up and turning it down. So I think it's important that you've shared that. It sounds like they've come a really long way. They're largely kind of less visible and it sounds like they're far more effective. So that sounds like something that is potentially an option for people out there. And then you just mentioned the cochlear implants, and I think it'd be great to hand over to Joe and Kathy to understand a little bit more about them and at what point does someone consider the implant instead of a hearing aid, and how do they differ?
I can start, Kathy. You know, as Lisa has mentioned, you know, the hearing aids ultimately work to make sounds louder. And there's fantastic outcomes with some types of hearing loss with hearing aids. But over time, your hearing loss can worsen and deteriorate. So if you are a hearing aid user and you are then continuing to find conversations difficult, especially in background noise, and you are still often needing people to repeat themselves, have trouble understanding or talking over the phone, and certainly if you're starting to withdraw socially, you know, those are some signs where the hearing aids may no longer be enough, and you should speak to your GP or audiologist for more information and another hearing test.
Great. Do you have anything to add to that, Kathy?
Yeah, just to share again. Yeah, so I think absolutely. For the vast majority of people, they will really benefit from hearing aids. And as soon as your hearing starts to drop, it's a good idea to step in and have a look at that. And often go back and see your audiologist to have it fitted to you. But cochlear implants are a great solution for people as their hearing might drop into ranges that the hearing aids just can't amplify enough. So particularly those high frequencies, once you're into the severe to profound range, the hearing aid just cannot sort of amplify that enough. And as you can see, cochlear implants have two components. So we have an outside component that just sits on the patient's head. So that might be sitting on the back of the ear, and there's also one that can just sit off the ear. And then we have an internal component which sits on the scalp underneath the skin. So nothing's going through the skin, it's all intact. And then it has a little lead going through the bone of the ear and into the cochlea. And that then stimulates the cochlear nerves directly. And very much the indication for a cochlear implant is when hearing aids are not enough. And we often ask, well, how do we know? And I think this is where you need that chat with your audiologist and also with your GP. But we often sort of say, well, with your hearing aids on, are you finding it difficult on the phone to hear people? Are you having trouble hearing children's voices, or do you struggle to hear in a background noise, in a crowded place? And if the answer is yes to any one of these questions, then you can go to your local cochlear implant centre and have some further testing, which actually can work out whether you're going to be better off sticking with your hearing aids or whether a cochlear implant will give you a bit more hearing. And there's been a big change over the years. So when I first started doing cochlear implants 25 years ago, it was like you had to be profoundly deaf and nothing more. But as cochlear implant outcomes have improved, then that tipping point has changed. And as hearing aids can improve, that tipping point keeps changing. So it's worth just seeing what's working for you and then thinking about things. But there was a suggestion by Teresa Zoland, a good paper suggesting that once your hearing loss is around 60 decibels across the range, so that's sort of a moderately severe sort of range, and if you're getting less than 60% on a very simple word score, then it's worth actually having a look, seeing your local cochlear implant program, and they'll do some further testing. And you can see for us here in Sydney with Next Sense, and we've got centres in different places in Australia, but we very much, the audiogram is used as a screening tool, so very much into the severe range in the bottom, but you can even have more hearing in the low frequencies. But then it's about what you're actually able to do with that hearing. How many words, like, can you pick up words? How good are you picking up the words or the sentences? And also quality life questionnaires and such. When we think about hearing aids versus cochlear implants, the idea is that the cochlear implant actually stimulates the cochlear nerves directly, whereas hearing aids just amplify the mechanism that sends sound through to the inner ear. So they very much help people, they both help people with hearing loss, and they're indicated at different stages of hearing loss journey, and not everybody will need a cochlear implant, certainly not. Cochlear implants are for people with more severe hearing loss or poorer speech understanding. With hearing loss, you lose both the volume of sound, but you lose the clarity as well. Hearing aids can amplify that volume, but it's not as good at amplifying the clarity. Whereas cochlear implants can actually stimulate the nerves, so they can actually improve the clarity as well as the volume, and often aided levels bring you up to within a normal to mild hearing loss range. Great.
So it sounds like if you're still in sort of that moderate phase, the hearing aid might be the direction that your audiologist takes you down, and for the more extreme cases, it would be the implant. And Jo, so what are the costs associated with these devices, and what are some of the funding options available to people?
Great question. It would be the number one question that people ask our team, as you can imagine. So funding for cochlear implants can work a little bit differently to hearing aids. We're really lucky that in Australia, for those who are suitable for a cochlear implant, that there are both public and private pathways. So in Australia, private hospital health insurance or DVA card holders, that can cover up to 100% of the cochlear device costs. And if you don't have private health insurance, the government offers funding for cochlear devices, the surgery and the fitting through the public hospital system and public cochlear implant programs. So If you have any questions around funding or needing to help navigate that, or would like local information on who to go to and what pathways are available to you, we do have the Cochlear Engagement team that offers a free to answer any questions that they may need.
Awesome. Thanks, Joe. That's a wonderful service, and I'm sure you'll get taken up on that one. So before we head over to Q&A, we've got one final question for Kathy, and that is really, what does life after the implant look like? Is there an aftercare process? Is it more of a set and forget, so to speak?
Yeah, look, certainly with the cochlear implant, you'll have mapping where the implant is made louder to fit your hearing, like your inner ear and your brain sort of preference. And often people will have that mapping once a year going forward just to check that the implant's working well and that it's ideally suited to you. And then auditory training is really important. So people need to actually use their cochlear implant and use that ear, because often, as Lisa was saying, that they've just not paid attention to that ear over time as the hearing has dropped down. So there's practice with friends and family listening and chatting. There's various programs on the computer that they can use to help improve their auditory listening skills. There's podcasts, listening to podcasts, audiobooks, listening to audiobooks. There's lots of different ways, but the big thing is for all of us is that we need to actually, just like we go to the gym and try and stay fit with our muscles, we need to actually exercise that brain of ours and keep listening and put ourselves into situations where we are using our hearing and using our cochlear implant or our hearing aids effectively.
Great information and great advice, Kathy. And whilst it's important for everyone to prioritise their hearing every day, as it's World Hearing Day, it's a great reminder to be proactive about your hearing. So if you've been putting it off, now's a great time to have a conversation with a loved one or go and seek help for yourself. So we've covered some of the hidden risks rather associated with hearing loss. And in some detail, the solutions available, but we've had a number of questions come in from our viewers as well, which we're about to answer. Before we do, I just want to remind everyone that we're providing general information that isn't personalized to your specific individual situation. So if you have questions or concerns regarding your health, please get in contact with your GP. So with that in mind, we'll click over and start going through some of the questions that we've got. Okay. You bear with me.
I can see one that I'll quickly answer.
Okay, go for it.
There was a question saying, do you have to show your cochlear implant or can you have it underneath your hair? And you can certainly have it underneath your hair. So, you know, for women, often you can't see anything. And even, you know, some men's longer haircuts can sometimes hide things as well. Yeah.
Great. Okay. Question 4. We have Trevor asked, is it true that your hearing declines quicker once you start using hearing aids?
I think that we have that so often, because people say that with glasses, you know, once you wear glasses, your sort of eyesight deteriorates. It's, you know, Kathy and myself have mentioned it today already. You have to stimulate your ear and your brain to be able to keep it. So it's exactly the opposite. And you know, and Kathy, you might want to comment on it as well. Actually, one of the questions we ask for your candidacy to get a cochlear implant is a good hearing aid user. So if your hearing aid is gradually deteriorate over time and you've been wearing a hearing aid, your outcomes with a cochlear implant will just be so much better. So definitely it will not decline, it will improve.
Totally agree, Lisa. Yep.
Great. We have a question here from Rhonda. Is it still necessary to have the cochlear connection visible on the scalp, or are there options where it can now be camouflaged under hair?
That's the one I just answered.
Oh, my apologies. I thought here we go, right off the bat. Okay, when an outcome is described as good with HAs or CIs, what does that mean the person might experience? Are you thinking speech perception, environmental awareness, or something else?
Did you want me to sort of start with? And the one thing we do before you get a hearing aid or a cochlear implant is we identify the situations that you want to hear well in. And we call that a COSI. So it's setting up some goals for you so we can understand what your needs are. We also do a range of speech tests. And then once you've got your hearing aid or your cochlear implant, we see how well you do compared with against your goals. So see, have you been able to achieve the goals you've been able to set? So those are subjective, you know, how well you're hearing in the situations that are important to you. But we also do speech tests. So before you had a cochlear implant, this is how well you were able to understand speech. Now that you've got a cochlear implant, this is how well you can understand speech. So we both do it subjectively and objectively. So it's really comprehensive, and I'll pass over to Kathy if she wants to add to that.
Yeah, I think it's a good question. And I guess, you know, at the end of the day, hearing aids and cochlear implants are trying to improve your hearing, or certainly improving it. But is it quite as good as normal hearing when you were 15 years old? You know, it probably isn't as good, but very much your goal setting and also that practice, that auditory training. So one part is to get the sound into the brain, which is through hearing aids and through cochlear implants. The other part of the equation is actually get the brain listening to your ears, and that can also be improved with auditory training as well. But certainly, yes, we would think a good outcome is that you can do the things you want to do, but you know, using a phone, being able to catch up with people in a noisy background, but noise is always our problem, and technology is improving again and again, trying to filter out that background noise and improve spoken language sound.
Great, thanks guys. And Janice has asked, I have severe tinnitus and would like to know if there are any developments in the treatment of it, and also if hearing aids make it more pronounced. She also comments that she's sure she would hear more clearly if she didn't have a cicada chorus to compete with. So we can't help with the cicadas, but if you guys could touch on the main question.
I'm happy to lead off. Look, tinnitus is a really complex condition and really tricky, but actually wearing a hearing aid will often help suppress the sound, or wearing a cochlear implant, because you've got other sound coming in. So it's a bit like us in summer. You can hear the cicadas, but you're watching telly, you notice that they're there, but you know, you don't sort of make comment. You go to bed and it's quiet in the room and you go, gosh, the cicadas outside are really loud. Same with our tinnitus, that having some input from outside noise helps to suppress it. There is a lot of work looking at tinnitus, and I think, you know, everybody's situation is different, so it's hard to be generalized, but there are sort of some medications, there's investigations that you need to do, but I would very much say that by wearing your hearing aids, that will actually help suppress the tinnitus for many people, and it even suppresses it for a few hours after you stop wearing them for some people. But every morning before you put your hearing aids in or put your cochlear implant in, it will be back up at that level. Having said that, for many people, they will tell you a story that they've had terrible tinnitus over time, and it just seems to melt away as well. So there's a lot of cognitive therapy about sort of trying not to pay attention to the tinnitus and just relax and try and not think about it too. So it's a complex area.
Great. And Ella has asked, how do you know what the correct hearing aid is for your hearing loss? So which one is required for your level of hearing loss?
I can take that one as an audiologist. There is a large range of hearing aids. There's styles plus the technology. So it really starts with a very detailed history that we take to understand what your lifestyle is like, where you want to use your hearing aids, what your health is like, what your dexterity is like, what your vision is like. And then we do the hearing test, so we understand what kind of hearing loss you have, what extent your hearing loss is at. And those things together, we then decide what hearing aid or referral for cochlear implants, but then what hearing aid in this case is best suited to you. So if you have dexterity concerns, we're not going to fit you with the same hearing aid as somebody that doesn't. If somebody has got a full-time executive job versus somebody that really wants to hear the TV really well and have one-on-one conversations just with their loved one. Those are two different technology hearing aids. So it's really important, if you do go in for that hearing test, to consider hearing aids, really think about, what do you want to get out of this? Where are you going to want to use your hearing aid? And what is the lifestyle maybe that you want? Because some people have left it for so long, they might not have the lifestyle that they want. So they've started getting hearing loss 10 years ago. They haven't done anything. So they've stopped going to the bowls club. They've stopped seeing their friends and their family. But maybe that's why you want to get the hearing aid. You want to get back there. So really think about those things before you go in, because that way you get the best hearing aid at the end of the day.
Great. Thanks, Lisa. Archangela has asked, what sounds will I hear when my implant is turned on? And can you explain what mapping is?
You happy for me to take that, or
not?
Look, it's really variable. So if you look at YouTube, everybody seems to hear spoken language at switch on, which is really not the case. The vast majority do not hear spoken language at switch on. Often people will hear beeps and buzzers, or they'll hear like a Mickey Mouse sort of speech, quite high pitched. But then your brain very quickly adapts, and within, even within like half an hour of leaving that first mapping session where you thought sound was quite loud, often the brain's going, oh, it's actually not that loud, because people turn it on quite softly. The audiologist will turn it on softly so you're not sort of freaked out. And then over a number of weeks, they'll turn it up to a normal loudness level, because that ear has normally not heard at a normal loudness level for, potentially even decades. So yeah, it's variable. Everybody's different, but very quickly you'll actually be hearing spoken language, and very quickly you'll be sort of following, you'll be better off than you were pre-op, often within a month, but definitely within a couple of months as your brain gets used to that sound. But that's where you also need practice, because if you're only listening to somebody talking for, 10 minutes a day, then your improvement's going to be slower. So you do need to have that auditory training practice. Even reading aloud to yourself in those first few weeks is really helpful, so that your eyes and brain know what you're saying and you're training your ear to listen. And you'll be given simple tasks by your audiologist to practice with people. Yep.
Great, fascinating. And I'm hearing you're not on your own. You're basically being helped through this process with an audiologist. All right, Maria has asked, how do you choose a reputable company for audiology testing?
Yeah, there's so much, as an audiologist myself, and I just love the industry, and there's so much negativity about our industry out there. And, you want to find a qualified audiologist. You want to go to an audiologist that's going to give you all the options, have a full comprehensive test, and that will consider all the options. It's not just going to consider one hearing aid and one style, and not consider a cochlear implant or consider assistive listening devices. So maybe it's the same as my previous question, is go in armed, know what you want to get out of the appointment. And if the audiologist is qualified, they can give you the information that you need to get. But if you're not happy, you can get a second opinion. But the industry is not as bad as people make it out to be. There's some very, very, very good audiologists out there, and don't let that be the thing that puts you off.
Yeah, great advice. I think that the main message is be proactive. There are a lot of other side effects other than just not being able to hear, the TV or your loved ones speaking. We're hearing about cognitive decline and mental health. So don't let those sorts of things stand in your way. And if you ever seek out a service and you're not happy, you can always go and get a second opinion. So please don't let that be something that stands in your way. So Neil has asked a really interesting question. Can a double implant be done at the same time when you suffer from profound deafness in both ears?
Yes. So it's common in children. So we often do it in children. For adults, it will depend. Sometimes we can do it, and it's starting to be done. there's always when you open up the cochlea and you pop the implant in, it takes a little while for that opening to fibrose and close. So sometimes people will feel a little bit unsteady. And so doing it on both sides, has a little bit more risk on that component, but you would be looked at carefully. And, sometimes the best thing is a hearing aid in one ear and a cochlear implant in the other. And sometimes things are best with cochlear implant in both ears. Often in adults, we do one ear just so that you've got one to sort of keep you going whilst you get used to the cochlear implant ear, and then we can step forward with the second ear if indicated. But it can be done simultaneously for adults as well.
Great, thanks, Kathy. Okay, the next one's not necessarily a question, but we might try to interpret it as one. So I suffer from earwax. I have my ears cleaned out every 4 weeks. Hearing aids keep blocking. So maybe is there a solution to this, or the question might be leaning towards, is another solution more appropriate given the circumstance?
Look, it's such a problem, isn't it? I mean, some people produce a lot of wax and other people don't produce any. It's so haphazard. I mean, if hearing aids are working well, you can try products like Ear Clear for wax and do it 2 or 3 nights in a row. And even if you're needing it cleaned out every 4 weeks, then maybe do it sort of 2 or 3 nights in a row every week or every fortnight, and that might help bubble out the wax so that your oral toilets are less often. But having a mold will then mean naturally the wax gets dragged out of our ear canals in a spiral fashion, and having a hearing aid mold often does sort of stop it then getting right to the outside. So it would be certainly worth sort of talking to your GP or your ENT surgeon about what are the options. I mean, there are different types of hearing devices. We didn't really talk about bone conduction devices or whatnot, but it really depends on your hearing loss and such. But yeah, some people just have terrible wax and we don't know why they overproduce wax.
And then I'll just add to that as well, is if the hearing aid does get blocked every morning, not at night when the hearing aid is, I guess, still warm and the wax is still soft, in the morning when it's all sort of hard, just to brush it off, you'd need to do a bit more hearing aid maintenance and cleaning, and really that means every day brushing it off, but also getting a hearing aid that is the most suitable. So that again comes to that point that there's many options, and people with a lot of wax may need a different hearing aid compared to somebody that doesn't produce any wax.
Thank you both very much. We have a few minutes left, but there's a few more questions that I think would be great to touch on. Narelle has asked one, which is less of a functional one, but I think one that a lot of people will identify with. So Narelle's question is, do you have any tips to help convince a loved one to get a hearing test? I'm sure my partner is suffering from hearing loss, but refuses to get hearing checked. I think that would be something that a lot of people are experiencing, and it would be a really valuable thing to get some advice on.
One thing I would just jump in with is that they now have really good apps on your phone. So like Mimi, M-I-M-I, you can download onto your phone, and if you have AirPods, so I had to borrow my daughter's AirPods to be able to do it. You can actually get quite a good, we'll call it screening, but pretty accurate sort of hearing test. And then if that's abnormal, then they've got the suggestion, they've got the reason to go and see an audiologist for a formal test. Otherwise, book both of you in and say,
Yes.
we're going to have that, and then we're going off for coffee afterwards. So maybe make it a combined thing, not just about them, but about both of you. But these, I think people will become much more aware now of their hearing loss because there's now more accurate apps that they can actually test their hearing at home and get an idea of whether they're in the normal range or not. And then that will be a good springboard to see an audiologist.
And the app's impartial. I guess it circumvents any issues around, it's my partner complaining about me again. It's just data coming out of an app. So there's no hidden agenda.
And it can be fun. The whole family can do it. And then it's sort of like, yeah.
Starts the conversation, doesn't it?
Yeah. Puts it in your hands.
That's a great idea. So maybe give that a crack with your partner and it should help to identify if there's an issue, and hopefully that can start you in a process to go and see a professional. Okay, so Teresa has said, I worked in a noisy environment for almost 20 years, and I now have hearing loss as a result. Is this reversible, and what are my best steps forward? Maybe
Kathy,
Lisa,
you can take that one.
Yeah.
Look, I think, working in a noisy environment is a risk factor for hearing loss, though not all noisy environments have caused hearing loss. So I would very much suggest that you get a hearing test, see your local audiologist, see your GP as well to check your ears, and see your local audiologist for a hearing test. And then you can see the shape of the audiogram, where your hearing loss is, and whether, in fact, hearing aids would help you at this stage or not. So, I think it all starts with finding out what's going on with your hearing loss. From the point of view of, is it reversible? Sensorineural hearing loss at this stage is not reversible, but there are reversible things such as eustachian tube dysfunction or wax in your ear, glue ear, things like that. So that's why it's good to see your GP as well to just check, is there anything that can change? There is a lot of research going on trying to regrow hair cells, and maybe in 5-10 years, we'll be able to say, well, look, for this amount of hearing loss, we can actually improve things. But at the moment, it's not reversible for sensorineural loss. But yeah, definitely get a hearing test ASAP and then go from there.
Great. Thanks, Kathy. And the final question from Bev, and I'll pronounce it correctly this time as tinnitus, not tinnitus. What are the best steps to take to finding a management solution for my tinnitus, please? My friend just doesn't know where to start.
So an audiologist is where you start, so you can understand the hearing loss, understand their sort of, I guess, their lifestyle, where they're having trouble. If it's only in quiet situations, then that audiologist can put them on a path. The audiologist, there are specific audiologists that specialises in tinnitus. They can then give you some strategies how to manage that. A hearing aid is a very, very effective, or a cochlear implant, depending on your type of hearing loss, but a very, very effective and proven treatment for people with tinnitus. But that audiologist will also then refer to a psychologist, if required, for cognitive behaviour therapy, which is also a proven therapy for helping people with tinnitus. Or the psychologist will just be able to identify, what was that trigger? Often when you speak to somebody with tinnitus, you sort of delve, they're like, I'm not sure, when it started this, and then you delve and go, actually, my mum passed away then, and it just is that trigger point that it happened for them. So identifying that is key in them being able to live with tinnitus in a way that it's not impacting their life anymore. So that's a very, very big part. Something with tinnitus that bothers people is it's like an alarm in your head that's telling you to do something. So as soon as you know that it's not a problem, so we often do refer off to an ear, nose and throat specialist like Kathy to do investigation to make sure there isn't something central going on. But once we can rule that out and we can, the client or the patient can understand the tinnitus a bit more, it actually is not bothersome anymore. And people say, yeah, I've got ringing in my ears, but it doesn't bother me at all. So starting with an audiologist is a very good place, and then getting the referral off to medical people, ENT, a GP or a psychologist, they will then send you off them. So it can be a bit of a journey, but there's definitely a clear pathway available for people.
Yeah, I certainly agree. And I think multi-pronged approach, I think, there's red flags for some types of tinnitus. So seeing an ENT surgeon is probably a good thing along the way. But for most people, just more relaxation techniques and not focusing on it. Sometimes there's some medications that we can use. And also there's tinnitus support groups can often be very helpful as well. But often by treating the hearing loss with hearing aids and potentially cochlear implants for the more severe, that will help suppress it. So it's a multi-pronged approach, but I think, as Lisa said, you've got it's a bit of a journey and there's a pathway, but yeah, there's certainly red flags as well with some people. So definitely see an ENT as well as your audiologist.
Great, thank you guys. And thank you everyone for all of your questions. I think they were a really great representation of what the broader community is probably wondering and looking to seek more information on. That's all we've got time for as far as the questions go. I'd like to, of course, extend a massive thanks to Cochlear for making this whole event available today. And most importantly, our esteemed panelists here, thank you for your time and sharing the research and information that you have today. I'm sure it was really worthwhile for everyone. I personally learned a lot out of it. And it's really highlighted for me just how important hearing is for our aging, our life, our mental health, and our cognitive ability. So thank you very, very much. If you want to learn more about Cochlear and what they do, visit their website at www.cochlear.com. And just a reminder to everyone that in the next few days, we will share a recording of this session out to everyone who registered via email. We'll also be posting it up on our website. So we spoke about the kind of the third party disability. If you've got loved ones or friends that you think really need to check this out, please share it with them. Because we'd love to be able to share this as far and wide as we can, given the importance of the issue. And we hope to see you all again at another Starts at 60 masterclass. But in the meantime, stay happy and healthy.
Bye.
Thanks,
Thank
everyone.
you. Bye.
Bye.